Hi, Matthew.
Hi, Dr. K.
So you're here for your annual physical exam, okay? Can you verify your last name and date of birth?
Smith.
Okay.
And date of birth is June 2nd, 89.
Perfect. When was your last physical?
8 months ago.
Okay. Any concerns you'd like to address today? Any pain?
Yeah, I'm having a lot of headaches lately.
Okay. How long do the headaches last?
They last for about 6 hours, I would say.
Okay.
They turn out into migraines. Super
Okay.
bright light bothers me.
Okay.
And also very loud noises. I mean, they bothered me before as well, but now it seems a little bit too much.
Okay, so at what point do the headaches start increasing in severity? And
I would say over the course of 3 months.
okay, for the last
started.
few months. Okay. Do you notice that this happens at any time of day, at night, morning, after you eat? Any kind of pattern that you can recognize?
Maybe more in the afternoon.
Okay.
But I could wake up with a headache, and
Okay.
that turns out into
Sure.
a migraine pretty quickly.
All right.
Around noonish.
Do you drink coffee?
I do one coffee a day.
Okay. That doesn't seem like it'd be the problem. Have you been drinking coffee for most of your adult life?
Yeah.
Okay. Any thyroid problems?
I was diagnosed with hypothyroidism about 4 years ago.
Okay.
And I was on medication for a year and a half, 2 years almost. Okay. And then they slowly tapered me down.
Sure.
And now I'm not on any meds.
Oh, that's great. Okay. Any symptoms now?
I don't know.
Still? Okay.
I don't know.
All right. You can go ahead and check on that. Any abdominal discomfort?
No.
Okay. Pain anywhere else in your body, especially when you're having the headaches? Do you hurt, say, like your neck, back, anything?
It definitely radiates in the back of the neck.
Okay.
And it goes down to the back of the shoulder.
Okay. I'm going to be giving, as part of your exam, I'm going to be taking a look at your spine and your back and your musculature there.
Okay.
Great. Okay. So do you take medications on a daily basis?
No, just vitamins.
Vitamins, okay. What time of day do you take your vitamins? Do you take it before or after you eat?
I don't keep track of that.
Okay.
Mostly when I remember, if I remember.
Sure. Yeah, I'm sure it's not the reason for your headaches, but it can definitely exacerbate your headaches if you take vitamins on an empty stomach. You might be experiencing more headaches along with some nausea. That could be easily fixed if you just take it when you have your first meal of the day. Do you have any numbness or tingling sensations in the face?
No.
Okay. Anywhere in the body?
No.
Okay. Any surgeries in the last year?
No.
All right. Breathing problems?
No.
Okay. When was your last pap smear?
2 years ago.
Okay. So you're not due for another one quite yet. All right. Any head injuries that you remember?
No, I don't think so.
Okay. Any falls?
No.
All right. And so, okay, I'm going to go ahead and start with your vitals then. I'm going to take your oxygenation. If you could hold out your index finger for me and then cross your legs. Thank you. Okay. Okay. If you could hold this in your mouth for me. All right, you were at 93 at room air. Your heartbeat is 90 per minute, so that's a little bit low in terms of oxygenation. So, all right. Okay, I'll go ahead and take that. You're 97.9, so that's normal. I'm going to take your blood pressure now. Do you have an arm preference?
No.
Let's go ahead and use this arm then. Okay. All right. Okay. Okay, so you're at 90 over 70, so it's a little bit low. Have you been feeling any dizziness this morning? No. Okay. Did you have anything to drink before you came in?
Coffee.
Okay. All right. I'd like to look at your pulse, so if you could just give me your wrists. Thank you. Okay. 2 plus. That's normal. Just going to look at your capillary refill here. Very good. Okay. Use your other hand. Okay. Just take a look here. Just looking for symmetry. I don't see any visible signs. Okay. So I'm looking at initial inspection of the face. I don't see any visual signs of drooping. Your skin looks very well perfused. I don't see any irritation or redness. No visible signs of edema. I'm going to go ahead and palpate your head. I'm just looking for any lumps or signs of a concussion or anything that might be causing the headaches externally. So just relax. Any pain?
Maybe a little bit in the back.
In the back? Okay.
And it's in the back a little bit lower.
Okay.
Towards the right side.
Okay.
Yeah.
So right here along your cervical spine.
Yeah.
All right. Okay. And how would you describe the pain? Is it like a throbbing pain when I touch it, or
dull?
A dull pain? Okay. All right. I'm going to palpate your lymph nodes, looking for any enlargements. Okay, everything feels normal. I'm going to palpate your sinus cavities here. Okay. I feel some slight swelling on the left side, so I'm going to do some measurements. Just looking for symmetry. Great. All right. Just here. Okay. A little bit of asymmetry on the left side. Okay. Okay, go ahead and scrunch up your shoulders. Okay, and then let them go. Okay, any pain here? Okay. If you could hold out your arms for me, just stretch them. So, just and that's okay. Going to listen to your heart and your lungs. So, just breathe normally. Very good. Okay, listening on the bell. Okay, great. Listen to your lungs now, so if you can move your arms to your sides. Very good, and just give me a few deep breaths. Okay. Sounds clear. Okay, very good. I'm not too worried about that. Do you have any history of smoking or vaping?
No.
Any lung disorders in your family?
No.
Okay. All right. Are you wearing contacts or glasses?
No.
Okay. When's the last time you had an eye exam?
6 years ago.
Okay. Any problems with vision?
No.
Okay. I'm going to refer you to an eye exam, to an optometrist, because it's good to get your eyes checked at least once every 5 years, even if you're not noticing any symptoms, just to be preventative with things like glaucoma or a loss of sight.
Okay.
But I'm going to go ahead and test. So go ahead and look at my nose, okay? Looking for pupil dilation. Okay, keep looking at my nose. Don't move your head. All right, excellent. Okay, I'm going to look at your optic nerve, so just look straight ahead with me. Okay, pupils look round and reactive. I don't see any signs of jaundice or redness, so that's good. Good. Looking straight ahead. Very good. Okay. I'm going to go ahead and just look at the lower lid here. Looks healthy to me. So you're going to go ahead and follow the light for me. Ignore my fingers and keep your head straight. Excellent. Now let me know when my fingers enter your field of vision, okay?
Down.
Okay.
Down. Down.
Okay.
Down.
Very good. Okay, I want you to go ahead and hold this chart for me at arm's length. Good, okay. Can you read this fourth row here?
Oh. The whole row.
The whole row, yeah.
Okay. O L C F.
Okay, what about this row here?
E B T C O.
And the last row?
L D F B H.
Good. What color is this?
Orange.
Okay, what color is this?
Brown.
Okay. You are definitely showing signs of color blindness. So I think it's really important to send you to a specialist for that because the colors were red and green.
Okay.
Okay. So have you noticed yourself having color issues?
No.
Okay, no family or friends have told you you're wearing different colored clothes than what you think? Okay, all right. Well, it's definitely something to get checked out. I'm going to point to a couple different circles. Tell me which one is bigger, 9 or 2?
9.
Okay, 6 or 5?
6.
Okay, 3 or 2?
3.
Good. Okay, I'm just going to take a look inside your mouth, so if you could open wide. Okay. All right. Don't see any swollen salivary glands. Tonsil looks normal and healthy and uninflamed. Very good. Okay. Go ahead and stick out your tongue for me as far as I can go. You can move from side to side, up and down. Any difficulties in doing that?
No.
Okay. Go ahead and raise your eyebrows for me as high as you can go. Good. Now try to lower them. 3, 2, 1. Okay. Now lower them like you're angry. Try to raise them. Good. Okay. I'm going to be placing 2 of my fingers here on the bridge of your nose. Try to turn your head all the way to your left. Good. Other side. Excellent. Same thing, except I'm going to be placing my hands here. Okay. Great. Now try to look up at the ceiling for me. Good. Chin to your chest. Excellent. Okay. If you could stick out your arms for me. Okay. Try to lower them. Good. Now try to raise them. All right. Now try to bring them outwards and inwards. Very good. You can go ahead and rest. Okay. Now go ahead and try to shrug your shoulders. Try to lift them up. Good. You can relax. Excellent. Okay. Any issues with your nose? Have you noticed yourself snoring or any difficulties breathing at times?
Yeah, I do snore at night.
Okay, that could be a deviated septum. I'm going to take a look here to see if I see anything visually. Okay. Alright, I see what could be a deviated septum because your nose is slightly asymmetric. I will refer you to an ENT if need be, but first I'm going to do a test. Okay, so I'm going to obstruct this nostril. I want you to breathe normally through that other nostril. Okay, and now I'm going to gently bring the cheek back. Breathe again. Did you have a better time breathing when I moved your cheek than without?
No.
Good. Okay, let's do the other side. So just breathe normally. Okay. Breathe again. Any difference?
Yeah, I was breathing better.
When I pulled? Okay, that's a sign of a deviated septum, and that would be a good candidate for adjustment to your cartilage. It's just a very minor surgery, so I'll definitely refer you to someone I know for that. Be looking at your ears now. All right. Any issues with hearing that you've noticed? Ear aches? Anything?
I did notice that I feel some popping in my left ear
Okay.
and very rarely in my right ear.
Okay, does this correspond to you opening and closing your mouth? Does it happen more when you chew?
It happens when I swallow.
Okay, all right, that's good to know. I'm going to go ahead and take a look. Any pain that goes along with that, or is it just the clicking?
No pain, just
Okay.
the popping sound.
Okay, all right. Have you been diagnosed with TMJ disorder?
Not that I know of.
Okay, go ahead and look straight ahead for me. Okay. I do see a bit of wax buildup here, but other than that, I don't see any scarring or scratching. No abnormal fissures. So that's good. So that tells me that your popping issue is most likely a jaw issue. Okay. I'm going to look in this ear. This looks healthy and normal. I'm not concerned. Okay. I'm going to be making a vibrational sound with this tuning fork and holding it against your ear. Let me know when the sensation stops for you, okay?
Now.
Good.
Now.
Okay. And which is louder, position 1 or position 2? So here's 1, here's 2.
1,
Okay. Here's 1, here's 2.
2.
Okay. And let me know which ear you hear this rustling sensation, your left or your right, or both.
Left. Right. Both. Left.
Good. Okay. All right. So, let me go ahead and just palpate your arms. Just feeling for any signs of swelling. Okay. And just rest your arms like that. Perfect. Okay, so I'm going to ask you to go ahead and turn around so I can examine your back. Put your hair to your side so I have better access. Okay, so just relax. I'm just going to be palpating your spine and looking for signs of a deviated curvature. Okay. going to check for scoliosis. So go ahead and try to touch your chin to your chest and just bend forward. Okay. All right. Curvature is normal, symmetric, and healthy. You can go ahead and bring your neck back up. Very good. Okay. I'm going to just take a few measurements just to ensure symmetry. Exactly. Just one. And on each side. Okay, so some slight asymmetry in the lower back. Okay. Yes. This is right. This is okay. Okay. Now, did you feel any pain when I was tapping your back?
No.
Okay. I'm going to do a sharp and dull test. So, do you feel this sensation on your back?
Yes.
Okay, it's kind of a fuzzy sensation that's going to be dull. And then this will be sharp. Do you feel the difference?
Yes.
Okay, so go ahead and say sharp and dull whenever you feel the sensation, okay?
Okay. Dull. 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 Sharp. Dull. Sharp. Dull. 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 Sharp.
Okay.
Sharp. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Dull. 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 Sharp. 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 Sharp.
Okay. Definitely some loss of sensitivity in the upper right side. All right. So just breathe normally. I'm going to go ahead and listen to your back. Okay. Okay, now take a few deep breaths for me. Okay. Another deep breath for me. Okay. Okay, and one more. Okay, great, Mad P. So next, I'm going to have you go ahead and lay down so I can examine your abdomen and also your legs and feet, okay? Okay. And do you mind if I pull the shirt up just a little bit? Is it okay? Okay. So I'm just taking a look at the skin. I'm looking for any visible signs of asymmetry or hardened protrusions. I don't see anything. Have you been having any stomach pain?
No.
Okay. All right, I'm going to go ahead and palpate, okay? Just feeling gently. Do you mind if I lower the pants just a little bit? Just need to have access to the organs on the lower side and your lymph nodes. Okay, non-palpable. That's good. Okay. 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 Just going to take a few measurements here just to gauge for symmetry. 26. Okay. Okay. I'm going to be placing the tuning fork on both of your hip bones. Let me know when the sensation stops, okay? Okay. Good. Okay. And does this feel like a sharp sensation or a dull sensation?
Sharp.
What about this one?
Dull.
Okay. Just going to be doing a few of those since you had some issues along the back. So just say sharp and dull.
Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Sharp.
take off your socks? Okay. All right, I'm just going to assess your feet visually. I don't see any swelling. Okay. Your pulses. 2+. Very good. You must lotion regularly because your feet are very soft. Okay. Just going to measure for symmetry here. That's 15. It's 21, okay? Okay, good. No edema at the ankles. Going to do a Babinski response test. Okay. Okay, that's a no reaction. So that is abnormal. I'm going to look at your capillary refill. It's 3 seconds, so I'm seeing a bit of numbness and loss of circulation to the feet, which might correspond with your back pain. Okay. Okay. All right. I want you to try to bring your feet up towards yourself. Okay. Okay. Good. Now push against my hands. All right. Could you spread your toes as wide as you can? Okay. Now scrunch them up together. Any difficulty in doing that? No. Okay. All right. And does this feel like a sharp or a dull sensation? Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Okay. Just going to take a look at your feet, or your legs. Okay. And as I bring this brushing implement, I'm going to bring it from below your knees to your feet. Let me know if you feel it all the way, or if there's a point where it becomes numb, okay? All the way. All the way. Good, okay. I'm going to have you sit up and we're going to go over the results. Okay. Okay, Mad P. So the results of the exam came back to where your vitals were normal. I did notice that you have a deviated septum, and I'm especially concerned with the loss of sensation on your back, on your upper right side. You had a lot of those inconsistent responses to the sharp and dull test, so I think that there might be a neurological problem that might explain your headaches as well. Okay, so I'm going to refer you to a neurologist and also order a CT scan just to make sure that everything is going okay, and we'll go from there, okay? Okay. All right, do you have any questions? All right, great. So I'm going to give you a follow-up call in a few days just to see how everything is going, and we'll go from there. Sounds okay. Okay, great. Well, it was great to do this exam on you. Thank you. All right, bye.